Hey everyone, it's Dr. Crad. Safe, effective, convenient, continuous, inexpensive. This is what we would all want from a glaucoma treatment. That would help our patients be compliant with their treatments. If you have glaucoma and take an eye drop every evening to reduce your eye pressure, there's a high chance that eye drop is a prostaglandin drop. It might be called Latanoprost, Lumigan, Latanoprost, Travoprost, or Travatan. There are many different versions available on the market. The iDose TR is a tiny FDA-approved implant that has a reservoir of Travoprost prostaglandin medication in there, which continuously releases medication to reduce eye pressure in patients with either open-angle glaucoma or ocular hypertension. The hope is to provide long-term, around-the-clock glaucoma management, since drops are associated with inconvenience, inconsistency, non-compliance, copays, and unwanted side effects on the surface of a patient's eye. With the iDose implant, the medication bypasses the surface of the eye and releases medication 24/7, ensuring consistent eye pressure control. Not all, but most patients don't need to worry about putting in drops anymore. The iDose is anchored to the trabecular meshwork. For some patients, the reservoir of medication can last many years, after which it could potentially be removed and replaced with a new one, although its replacement is not currently FDA approved. So at the moment, replacing it with another one would be an off-label use of the iDose. But who knows, in a few years' time, hopefully there will be even longer lasting implant options to choose from. Although it has a high success rate, like any procedure, there are risks with iDose implantation. These include but are not limited to infection, inflammation of the eye, swelling of the retina, damage to the interior surface of the cornea, and similar to prostaglandin eye drops, a patient's iris can have increased pigmentation. Fortunately, my patient is doing great. No side effects, 20/20 vision, and great eye pressure without any drops. Does the iDose TR check all the boxes? I think it depends on whether your insurance will cover it. Ask your surgeon if you are a good candidate. Thanks for watching. I'll catch you on the next one. Peace.